Thanks everyone for joining. This is Aurora Health Alliance's Unhoused Connections group. Um, and we're here to connect, learn from each other. And so we are really glad you're here. My name is Jo Glaviano. I am the program manager with Aurora Health Alliance. Otherwise, I would like to introduce Jessica Tran with 211. Jessica, I'll let you go and take it away.
Thank you so much for joining me this morning. Um, we will get started right away, but I just wanted to give a little bit of gratitude for all of the work that you guys do and for Raquel actually pinging me. Raquel's actually one of my really good friends, and she was like, "You should join one of these groups one day." And I was able to chat with Mandy and Joe, and we got this started. So thank you, Raquel, for putting this on. Really excited to present to you guys today. I'm just going to go through a brief, introduction about myself, the programming that we have at 211. Hopefully you guys have all heard about 211 in some capacity, just by like a show of hands or reacts, like who has heard about 211 or has used 211 in some capacity? Wonderful. I see a few hands already, so that's amazing. So, to get us started, my name is Jessica, and I am the Data Systems and Partner Strategy Manager at 211 Colorado. So, my team is primarily responsible for maintaining some of our partner agency information. So, all of the agencies and services that we have in our resource database, that is vetted by one of my staff members every single year. So, we do an annual verification with someone who works at that agency because, I can always get information from, online or on Google, but the most important information is going to be vetted with someone. So we're making sure that that is information that is current and accurate, and up to date. So when our navigators here at 211 are referring these services out, we can actually provide really up-to-date information. So that is one of my biggest roles. I work throughout Colorado, but I'm housed in downtown Denver. So if you are ever in the area, we do have a few really great services. Just to kind of give you a little bit of clarification, I am housed in Mile High United Way. So if you're familiar with like the Turkey Trot in downtown Wash Park, that's what we hold every single year. So Mile High United Way, we have a few different initiatives that you might be familiar with, but our biggest program is probably 211. So that's kind of how Mile High United Way and 211 works together to provide these services. So today I'm just going to walk you through 211 Colorado's statewide service footprint. Our contact volume and demographics. I actually pulled some really interesting information for Aurora specific unhoused populations. Some of the direct services that we have at 211, so you can use our services outside of our information and referral line, and then some advocacy and learning opportunities. This is the biggest training that I usually do, but we do have other ways that you can get involved with 211 if you're ever interested. So I don't know if you know, but 211 is actually nationwide. So there are over 200 211s across the United States. Each are team of compassionate, highly trained community specialists, usually local to the area, to be able to help provide local resources and services to address needs. So overall, we respond to about 16 million requests for help each year. This is coming through chats, calls, text messages of people looking for just basic needs, housing, food, transportation, and healthcare. So FCC, the Federal Communications Commission, designated 211 as a three-digit number for information and referral services, for specifically health and human and social services. This started around 2000, and the first two-on-one was out of Atlanta. And then we are the first United Way. Mile High United Way is the very first United Way. And you can actually find two-on-ones, like I said, throughout the nation. And while we in Colorado, we have different local nonprofits and United Ways that put on two-on-one. Actually, in other states, it might be, the federal government that's putting on their two-on-one. It just varies so much about like who is putting the program on. And then throughout this presentation, please feel free to stop me at any time or, ask a question in the chat because I want this to be a little bit more interactive, especially with such a small group. Please feel free to ask questions, or if you're looking for a resource that you don't know if it's in the database, just feel free to ask and we'll get to that. So in Colorado specifically, we service all 64 counties. There are actually four contact centers here in Colorado. So we have one in Colorado Springs, one in Denver, that's the one I'm housed in, one in Grand Junction, and one in Pueblo. So our Denver location, we oversee probably about 80% of the contacts that come through 211 just because of the volume that we have here in Denver. There are contact centers, like I said, in rural areas, and we're always trying to expand impact in rural areas. But I think that those communities maybe really value local outreach. And we are trying to put on a program of community liaisons. So there's like actually boots on ground, in-person resource navigation for some of those areas. But right now, we just have our contact centers. Any questions about 211 as a whole or in our state so far? Not yet. That's totally fine. Few ways to get in contact with 211. You can dial 211, and we do have bilingual staff. We do offer translation services that supports around 200 different languages with a partnership called TransPerfect. You can actually, I'm sure that many of you guys have translation services, but if anyone is calling from like a smaller nonprofit and they just don't have that bandwidth, they can actually call into 211 and we're able to offer those translation services. While, even if we're not technically servicing them, if like someone is, Google Translate's not working fast enough for them, they can call 211 and get that as well. You can text 211. If you text your zip code to 898-211, you're able to receive resources through text message. And then if you go to our website, we have a chat option online where you can talk to one of our navigators Monday to Friday, 8 to 5, or you can also search our database. I'll guide you through how to build resource lists and how to search our database in a few moments. But those are the three biggest ways to get in contact with 211. So this is just our contact volume for 2025. In 2025, nearly 220,000 Coloradans turned to 211 for help. So this led to around 400,000 referral connections to our community resources. And to put that in perspective, that's around 610 contacts a day or 18,000 contacts a month. Another interesting fact that I found was from our translation services, after Spanish, the top requested languages were Arabic, Dari, and French. And about a third of the folks that reached out to 211 reached back out with for a follow-up or they called for something else. I really like that fact too, just because it shows that, 211 is something that people don't reach out to for just one-time help. They come back to 211 looking for assistance. Another highlight, a data point that I wanted to highlight was we have a 94% answer rate with an average of 6 minutes and 52 seconds of us answering calls. We have around 28 navigators that answer calls just here in our center at Mile High. And then our average call length is 8 minutes and 56 seconds. However, our navigators are not limited to, how short the call is or how long the call is. We really just want to provide empathy to our folks and to get them to the right resources to get them connected to wherever they might need. So someone can be on a call for an hour and a half, or they can be on a call for 3 minutes. As long as they're providing empathy and compassion and information and referral connections to that caller, that's what we really, rate our navigators on. So I did pull together some numbers for our presentation. This is the demographics information for contacts specifically calling from Aurora zip codes. So for unhoused populations, we had a total of 1,149 calls from individuals who indicated that they were experiencing homelessness in 2025. And this is a presentation that I can send to Joe and Mandy after this so they can also distribute this to you guys. And if you guys had any additional questions about any of these data points, feel free to reach out and we can get that information. Or if you wanted to look for information specific to your agency, say that you wanted to find information for just Denver Health, we can find that referral and service information as well of like who is calling Denver Health and they are experiencing homelessness with that. Next slide I have is some of the top referred services of those folks who did call in. Some shelters and housing assistance, of course, that's going to be their biggest requested service. And some top referred agencies were Catholic Charities of Denver, Salvation Army Denver, Denver Rescue Mission. Of course, these are the big players in the game that, provide shelters and housing assistance across Denver Metro. Some top referred healthcare services included Medicaid, community clinics, general medical care, and urgent care services. And top referred healthcare agencies included Arapahoe County DHS, Salute Family Health, NextCare, Urgent Care, and Friends of Man. So this is just of those folks who did call in from Aurora, if they're indicated that they were experiencing homelessness, and of that, who did we refer them to for um, top referred agencies. And if they did reach out for healthcare services, these are who they reached out to or who we got them connected to. Doesn't necessarily mean that they did reach out to Salute Family Health. It means that we gave them the information so they can then take that information and reach out themselves. We do worm transfers as well. So if they said that, like, could you transfer me to this service? Like, we try to get them connected so they can take that first step in the right direction. Any questions about this data so far? Or about 211.
I had one. Um,
Yes.
I noticed that you had what the slide, I think 2 slides ago said that Spanish language color. Oh, one more, I think. Spanish language colors in the box. Language colors decreased in 24-25. Is do you think there was like an increase? Like what made up for that difference? Do you think it was just English speakers calling in, or have you all noticed
Maybe,
other speakers coming in? And it's okay if you
yeah.
don't
And I
have that
think
right
one
now.
of the insights that we gleaned from this was potentially the political climate that shifted from 2024 to 2025 of like, being maybe a little bit more weary of putting yourself in a vulnerable position. I think that was like probably one of the biggest insight that we could glean from that.
How much personal information do you collect from a caller?
Great question. So the demographics that I sent right here, you can also see that they can refuse information or to give out any points at all. So these are the big ones. I didn't include all the questions. So we're going to ask first name, last name, year of birth, military status, if they're employed, if they have any children within the household. We also ask, you know, where they're located. Um, any of this information can be refused at any time, whether it's they don't want to give the information or maybe they're undocumented and they don't want to put it out there. But this is all information that, we tell them to. We say that you can refuse any of this. And that's why I put refused here because it is kind of bigger numbers, and especially in a larger scale, it might not because of the refused, it might not, reflect a larger demographic because people don't have to reply. But this is all information that we take for some of our reporting that we do for our contracts, but it's all aggregated data. We do not provide any like unique identifiers for anyone.
Thank you, Jessica. A question, one of the slides said you have like 1,000 in-person meets. Is that possibly walk-ins or people just wanting to meet face to face rather than on the phone or in electronic media?
What a great question. Yes, so we do have a walk-in center here in downtown Denver. People can actually come and receive in-person resource navigation as well. Same services and the same questions that we ask when you're on the phone, but you can just meet up with someone. I always think it's a really great way to get it's like very it's not case management by any means, but it is just a way to, see what is available in your area. And I think that, when you meet with someone, that it's so much more impactful than just like calling into 211. So of the 1,800 in-person visits, that also includes outreach events. So we might do outreach and tabling events across Denver Metro or in other areas as well, with our other contact centers, and they might report, what are the in-person resource connections that we were able to provide to folks as well. So those are the biggest two places that we get that 1,800 for in-person
Great.
visits.
All right. Thank you.
Yeah, great questions, though. I'm going to skip ahead a few since we went over these. So some of these, we talked a lot about our information and referral services. What are some direct services that we provide here at Mile High or in 211? So we have SNAP application assistance to make sure that Coloradans have, sustainable access to nutritious and affordable food. We also offer application assistance to individuals applying for SNAP. In 2025, we received around 2,300 SNAP-related inquiries, and this could include anything from people seeking information on SNAP to applying for assistance. And we processed around 878 SNAP applications on behalf of our folks. I think this is really helpful as well because, some people they might not be able to get to the library to do a whole entire application, or they don't know where to get to the first steps of where to apply or how to apply. People can call into 211 and we can provide that assistance for them. Local county departments of human services and social services will still do the interviews, but at least we can get them through the interview or to the application process. We also provide our Ride United program. This is probably one of our most direct services because we can actually dispatch Lyft rides to address some unmet transportation needs to individuals and families across Colorado. So it does need to be to an essential location like job, employment services and benefits services, food, emergency shelter. Um, but, at least we can get them a dispatched ride. All they need is a text-capable phone. Case managers can make Lyft ride requests on behalf of the client, but the client still just needs to have a text-capable phone so they can indicate, where they are if the driver's coming, or they can request like a round trip ride as well. It's always going to be from point A to B and then B to A if it's a round trip ride. So you cannot go A to B, B to C, C to Z, and then back to A. So it just needs to be that ping pong back and forth. And then, Rack, I saw that you had a question.
Yeah, what is that? Sorry, there's a little fly by my face as well. What does that look like as far as like if someone recently got a new job but they don't have a ride to their job, like employment services, like they're going to consistently need rides. Is there a
100%.
limit to
Yeah,
what can be provided?
yeah, and this is a big question that I always get to because like people want that consistent ride, right? So this is really meant to be like a short-term temporary assistance. Like we don't turn people down. People can take, 10 rides. However, we are going to always offer other options like RTD's live income-based discount program. We're always going to try to get them to other places because it's not meant to be like a regularly scheduled pick me up every day at 8 type of thing. Great question. And then Rich, I saw that you had your hand up as well.
Yeah. So case managers don't have to do the referrals. I could call and say, I need a ride to King Soopers.
Yes, you can technically say that if you are saying that I have no food in the house and I need a ride to King Soopers today, or else I am going to have no food.
Okay. Thank you.
Yeah. And they can call 211 and they can request a ride. However, a Ride United specialist is still going to call you or your client back and ask and vet that this is a urgent ride for same day rides. We only do same day rides to food access points and to emergency shelters, but we do always request that there's going to be a 24 hours in advance appointment scheduling to give our Ride United specialists time to call them back. A little bit more data for you here. We scheduled around 1,600 rides last year, averaging around 138 rides a month in 2025. Um, Money doesn't grow on trees. This is something that we ran out of money last month on. But then this is a really, really fundraisable program that we have. United Way is a nonprofit after all, but our donors can see the benefit of this. And I think that there was one donor that just replenished like 15K and another donor that replenished it by 10K. So we're able to provide rides for at least for the rest of the year. Um, Other important data points with that was we noticed that around 22% of Lyft riders were over the age of 60, maybe highlighting the importance of transportation support for older adults. And then some of the top ride purposes were medical appointments. So for medical appointments, we might still connect them to non-emergent or yeah, non-emergency medical transportation, NEMT services if they are Medicaid members, food access, and employment. So those were the other two, high purpose rides. After this presentation, in addition to a PDF of this deck, I'll also send you a flyer to our Ride United program as well, so you could review it with some of your departments or, your clients, because it is a really awesome program that I love speaking about. Another great service that we have is tax prep scheduling. Tax season can be stressful, especially for individuals and families with limited income or those unfamiliar with the tax filing process. Even I only just started doing my own taxes a few years ago. My mommy did it for me every single year since, but some people don't have that privilege. So that's where we offer our VITA partnership with CDPHE, Get Ahead Colorado. So we have all of the VITA sites and AARP sites housed in our resource database that, if someone is calling for, where is the closest free tax prep site to me, we're able to provide that information. There are some sites that we can actually schedule appointments for them on their behalf. It's because Tax Help Colorado is housed in Mile High United Way, so we have a very close partnership with them. We can see the back end of their appointment system, so we can schedule appointments for them as well. Last year, we scheduled around 3,500 appointments on behalf of tax filers. And we do get a training from CDPHE about some of the available tax credits available to Coloradans. So if people had questions about specific state earned income tax credits, we're able to provide that information as well. The last direct service I wanted to talk about as well is our CCRR line. So this helps parents and guardians find licensed childcare around them and offer financial assistance information like CCAP. Last year, we completed 154 as well. Enhanced referrals. This is where our specialists will proactively contact providers on behalf of families to reduce barriers and confirm availability. So if I call CCRR line and I say that I have a 2-year-old, I'm starting work next month. I don't know what to do with my 2-year-old, and I don't know really where to start. So our specialists will be able to help find, financial assistance programs like CCAP, which is currently frozen. Or, they can call different providers 15 miles away from that employment, their job, and they can ask, those providers, like, do you guys have availability in that area? Are you able to take a 2-year-old next month? My child is this child is developing, has a developmental issue. Is that something that you can accommodate as well? And then Mandy, I see that you had your hand up.
I will share a personal bias. I've always assumed that 211 was for people with lower socioeconomic status, etc. Um, but it sounds like it could be for anyone needing help, like are there any like barriers for any person calling?
Yeah, I really think that's a great call out because honestly, I did not know about 211, and any single time that, people say that they don't know about 211, my first reaction is that's great because you have never felt that rock bottom. What do I do next? Where do I turn next? I need to talk to someone who can help me right now, right here. So, um, that's what people think about 211 as, that first access to basic needs, but there's a myriad of different resources within the resource database at 211. Anyone can reach out to 211. I have folks that, say that you had an elderly parent and it was snowing. I know that snow is outside of our minds right now, but like say that like you had an elderly parent and they lived in Greeley and you cannot get up to their house to shovel their driveway because you live in Denver, and there's no neighbors that can help your elderly parent. Greeley has programs. The city of Greeley has programs, and other cities have programs where they can provide residential snow shoveling services for your elderly parent. Or if you're in a wheelchair and you need to, have access to your car or your driveway.
Mhm.
They will shovel it for you. And those are the type of services that people don't think about, because they're in the database. There's volunteer opportunities in the database. If someone wanted to volunteer, but they don't know where to start, donation drop-off sites. That's in the database as well as like, we will meet clients where they need to be met, or we will get them to the right places where we can provide that service. It's not always just going to be are unhoused individuals. I've used the resource database for my own personal needs before. Um, but yeah,
Yeah,
211
it's
is for all
the
of them.
childcare like
Yeah,
assistance like in trying to figure out how those resources work, which that prompted me because it was really intimidating to do that
yeah,
when I first had kids. So
yeah.
thanks.
The next thing I wanted to talk about is our resource database, our resource directory that we house all of these agencies and services. So across the state, we have around 2,600 agencies providing over 7,000 services. Last year, we added 277 new agencies and then almost just over 1,100 services. Um, we do different approaches to this. So for our new agencies, it could be like last year in October when there was a big SNAP pause, like our resource database specialists worked on adding any food access points that we could possibly find. Um, we might say like, oh, go to Food Bank of the Rockies. They have a button or they have a phone number that you can call to find a food bank near you. But we flipped it where we were like, okay, we need to actually ensure that those food pantries that Food Bank of the Rockies provides is actually in the database so we can just get them to the very first step to a food pantry. Um, Maybe you guys, if you guys see that there's agencies that are popping up near you that, is not in our database, people will reach out to me and say, hey, I saw this really, really awesome program. It would be maybe a good opportunity for you guys to have as well. That's something that we might do for outreach. There are a lot more services in Colorado than just 7,000 services. This is just health and human services that offer direct services. So that is going to mean that, like, we want to ensure that if someone calls today, they can get access within very shortly after. We don't want it to be like, oh, you have to be a member of this church, or you have to have received case management for the past 6 months to receive this service. We only provide primary services, and then we only provide if it is for-profit entities, they have to provide free or low cost services. They have to provide Medicaid, or they have to take Medicaid or Medicare, or they have to offer sliding scale fees or financial aid because we want to ensure that, our populations, because that is a big population of who we serve, low income socioeconomic populations. That's who's calling into 211. So we don't want to refer them to a service that is going to be out of their reach anyways. That doesn't help them. It doesn't help us. So yeah, so we do a lot of vetting to ensure that we are providing a very tip-top resource directory to folks. The last thing I wanted to just chat about is some of our advocacy and learning opportunities. So people can actually request a call shadowing experience where you can shadow one of our navigators on a live call. It's super insightful to see, who calls into 211, what they're asking for. You can also tour our downtown Denver center, or you can invite us to any outreach events that you guys are offering in the future, and we can come and table at events. I also provide this presentation a little bit more in depth. It's completely customizable if you want it to be an hour or an hour and a half or whatever. I also go to conferences to do breakout rooms. Um, and if you would like to, provide this training to your team specifically, because I know we have a gathering of agencies here, I also provide, in-depth presentations like this to teams as well. If the last thing I wanted to just show you was our website itself, if you've never seen it. So this is our website. It's 211colorado.org. This is the database that we use for our navigators. So our navigators are able, like as an third party, you are able to access the same exact resource database as our navigators. Um, we do an annual update every single year for the services in our database. However, there are some services like rent and utility assistance that we will actually reach out to our providers every month because that funding is so variable. So Catholic Charities of Denver does rent and utility assistance. Every single month around this time, we'll ask, hey, do you still have funding for April? And if they say yes, they still have funding, we will ensure that that information is updated eligibility requirements or anything like that. And if they say, actually, no, we ran out of funding or we're going to run out of funding, we will remove it from our website and remove it from the database so our navigators cannot refer it out. And so folks can't find it on our website because we don't want to, overwhelm our providers with information or with referrals that they cannot tend to. And we don't want to provide that referral to our clients and they're just going to call back and look for something else. You can find different categories here. This is just some of our biggest top requested services, but we have so many different services. Like I said, we have volunteer opportunities. It's not included here, but that's something that we have. We have residential snow shoveling. That's a big one too. Not on here, but if you click on, say, basic needs and financial, you can see some of the subcategories that we might have. We don't have it listed out by specific populations. The only one that we do is immigrants and refugees. They have a tab here where they can, there's just some services that might be helpful for immigrants and refugees. This website is integrated with a screen reader, a Google screen reader. So that's right here. It says languages. You can change the screen to Spanish. I say screen reader a lot because the annoying thing about our website is like if I were to switch not Somali to Spanish, I wouldn't be able to technically say comida, which is really annoying because our database is not in Spanish. This is just a screen reader. It's telling me I have no comida because it doesn't have the word comida in our database. But if I look up food, it would obviously come up with stuff as well. So that's a really small caveat about our website. We're just a nonprofit at the end of the day. Another cool thing about this is my friend Ben, that is a benefits calculator that has been invented by Gary Community Ventures, a local nonprofit and foundation here in Denver. They have a really cool tool called My Friend Ben. Ben stands for benefits. We're good friends with them. And you can enter basic demographic information and you can find out tax credits that you might be eligible for, public benefits that you might be eligible for. I'm going to walk you through it just so you can see exactly how fast and easy it is. I've done this for myself to see if I'm eligible for anything. I'm not, which is good in one way, but it's just good to just see what is all out there. So ask me where I live. I'm going to go really fast because I know we're coming up on time. How many people do I have in my household? Let's say that I have 2 people in my household and say that it's me and my child, Junie, who is my cat. But in this, she is my child. And in my heart, she's my child. Raquel is laughing because she knows what Junie means to me. Um, and asked me about health insurance. Let's say that I do not know if I have health insurance, but I can indicate that I have employer provided health insurance, Medicaid, Medicare. If I have any special life circumstances to me, let's say that I don't. For income, let's say that I'm unemployed, which is unemployment benefits, and say that I get this weekly and I get $500. I can add additional income sources. I can add alimony. I can add child support if I wanted to. And it's going to ask me about my child. Let's say that she has CHIP, and let's say that she maybe has a developmental condition. She has no income. She's a baby. And then for rent, I can enter this information. I'm just going to go quickly. My rent's 1100. I don't have a mortgage, and I do have utilities. $40 sounds good. Don't have AC. I do have internet. And for telephone, let's say it's like $75. I don't have to pay insurance. For childcare, I'd say I pay. I don't know. How much is childcare, Mandy? I don't even know where to start. 500
For one, yeah,
for my 6-year-old? I have 500 a month.
it's been a bit, at least 500.
Okay. Okay. How much money do I have in cash? Let's say I have $100 in cash right now. Are we on any public assistance benefits? No, because that's why I'm doing this. Do I need any more information? Let's say I have diapers. My 6-year-old needs diapers. Concern about my child's development, food, job resources, yes. Um, maybe family planning. I don't think she's going to college. Okay. I got this information from 211. I do not want to any feedback opportunities. My information. And it's just that easy. You can do this on behalf of your client. You can get really, really into it. I did a very high level overview for us. My friend Ben found 12 programs available to me based on the very quick information that I gave me information about Medicaid that me and my child might be eligible for, SNAP. It gives me information of how long it takes to apply, how much money I could save. It also, if you click more information, it also gives you information of where to apply, who can help me apply, the languages that can help me apply in, information I need to bring to my appointment, brief information about the program itself. I can email this to myself. I can save it, print it out. It also might tell me tax credit information. Oh, I guess not. But usually it'll tell you tax credit information as well. But I guess I can't because I don't have any earned income tax credits. That's why tax credit doesn't show up. But if I did say that I did have earned income, that will apply here, where it will come up with tax credits. But really great information. We love my friend Ben. Rich, I see that your hand was up.
Yeah, well, thank you for this great overview of my friend Ben. Uh, it seems like a great resource. Most people don't know about it.
Yeah.
Um, but you mentioned the monthly resource navigation webinar. It's every month.
Yes.
And
Yes.
what does that cover?
Yes, great question. So it covers a very, very brief overview. We went a little bit more in depth of some of the slides, but it really talks about resource navigation itself, where I teach case managers, social workers, patient care navigators of how to build resource lists. And I talk about our 211 overview program. It really, yeah, so that's something that I do every single month. I can send you the link where you can sign up. This is the website that I made. So the next one that I'm having is Thursday, April 23rd from 3 to 4. And this is technically you already took it. This is kind of it, but it just goes more in depth of like resource building resource lists. And I can show you how to build a resource list here. You do need to log in with a very quick email and password. How to create a resource list. This is the SOP or the instructions for it. But when you search for a resource, say that I am looking for food in 80205. This is all of the resources near me for food access points. Oh, interesting. Oh, accepts donations. So this is a donation program that just popped up.
Thank you. There are a lot of little nonprofits that see people all the time and asking, or church offices, for instance, that people are coming in for other than spiritual care. Hey, they need 211 services. They could refer them, but it would be great if whoever the receptionist is has a little bit of more handle on the resources themselves, and that would be the way to
Absolutely.
do it.
Absolutely. Because, you can tell someone to call 211, but actually being able to help them in that moment and provide resources for them as well. That is usually who I talk to is like, anyone who might directly work with clients so they can be empowered to use our website as their own resource navigation. I know that everyone here probably has some PDF sitting with, resources that they hand out to their clients, or their teams have, a Word doc that is a living Word doc that someone makes. Um, this website is meant to supplement all of your work. I am not trying to replace anything that you have. I am just trying to help you find more resources because while that is a very static little PDF or PowerPoint that you have, this will give you information as it's added to the resource database or as it's changed. As soon as someone at City of Denver tells me it's actually Monday to Wednesday, it's changed on our website and it's changed on our website. That's it. Um, so that's the biggest, I would say, benefit of using our website over, using Google or something, because we do that yearly outreach or monthly outreach to ensure that this is in tip-top shape. I don't want my navigators to get screamed at saying that service wasn't even available. That's what I'm really trying to prevent. And so that's why we really ensure that this information is updated. I have a staff of three, five to help me do this every single day. So this is their job day in and day out, is ensuring that information is correct when they're passing it out to folks.
Great. That PDF you mentioned, it doesn't take more than a month or two before it's obsolete.
Yeah, absolutely. Exactly. And you were mentioning, the church receptionist. I just met with Catholic Charities of Denver and the Archdiocese of Colorado to provide this information for them specifically so they can go and talk about 211 and kind of trickle down. So now all the deacons, hopefully all the deacons have this information as well. So they can reach out to 211 themselves or they can pass out our cards and information to people who might need 211 in some way.
Thank you, Jessica.
Of course. One thing I wanted to show you before I stop talking, finally, is print and share. And you can actually send a resource to someone if you click print and share. So this is sending one resource. So you can email it, you can text it, you can copy the link, you can print it out right there. You can send that one resource to someone, or if you were to create a resource list and compile a few resources, you can send that whole list out to someone as well. But thank you so much for just sitting through this with me. And thank you to Mandy and Joe and Raquel for inviting me. Please feel free to reach out to us if you have any questions. Um,
Jessica, thank you so much. That you all do so much.
we
It's impressive.
we do
Uh,
so much.
yeah, and also seeing your relationship with my friend Ben is that's really great. That's such a neat connection to have because
Yeah.
they just go hand in hand for folks to
Exactly. And
do
the way that
both.
I talk about my friend Ben too is, a lot of the programs that we saw were long-term benefits. While you're waiting for your application for SNAP, where can I find a food pantry? While I'm waiting for WIC, where can I find a diaper closet, or a diaper program or formula? So it really is just meant to be hand in hand because my friend Ben shows us all the benefits that we can apply for long-term support, whereas two-on-one can help support you of what do I need right now? Where can I find resources right now or next Tuesday? So that's the cool
Yeah,
thing about, working hand in hand. But I encourage you to, talk about two-on-one. Reach out to me if you would like an in-depth presentation about this website itself. I gave you a little bit more direct services and, demographics and contact information or contacts around individuals in Aurora zip codes experiencing homelessness, but there's a plethora of information that I can provide specific to your agencies too. Like for Catholic Charities of Denver, I was able to break it down by programs, how many referrals they received, and of those referrals, who were those folks that were looking for help. So really great information that we house here in 211. Please feel free to reach out. But thanks for having me today.
thank you. There is another question I wanted to
Oh, yes.
highlight. Do you think 211 will be able to provide resources for the upcoming work requirements for a portion of Medicaid members? So if someone's calling, say, do you know where I could volunteer? Would that be something
Yeah,
211 may be able to
yeah.
provide?
So if they say just that, like I have work requirements or volunteer requirements now because of the new Medicaid eligibility and SNAP eligibility. Um, volunteer, if someone looks up volunteer, all volunteer things will pop up. So that's where they can get connected to volunteer opportunities.
Great. That's great.
Yeah.
Thank you. And then could you talk just really quickly about just funding? Are you federally funded?
So we do have some state contracts with some of our specific service lines. So CDPHE partners with us for the child care resource and referral line. We have a family health information line. No, family health line, FHL. That is also through CDPHE, where we provide just basic information about family support services, Medicaid, WIC, developmental delays information, things like that. So then we have another contract with surrounding specifically ADRD, so Alzheimer's, dementia, and related diseases. We have a landing page for them. So there's some cash flow in there too. Um, Mile High United Way gets a lot of donations specifically for our program because they can see that this is a huge need as well.
Mhm.
Um, so I would say yes, through primarily state contracts, but not through I can't think of any federal contracts that we might have.
Okay. I was
Yeah.
just curious, just a question came through around like sharing
Yeah.
that information,
Yes.
especially about folks that don't have
Yes.
documentation, et cetera.
Yes, absolutely. And that's a big question that we get to of like, of those folks, how can we help them? Um, Actually in our services, oh, I spelled food wrong. It's embarrassing. But I want to show you in the listing itself some of the questions or some of the fields that we do have. I just showed you a very brief overview of like the list view, but if I were to click more details, I can see, um, area served, the location that they're serving this from. What is the first steps to receive the service? You visit the website for more information. What insurance is potentially accepted? It doesn't ask it here because it doesn't apply, but it might say like, is this available to immigrants without documentation? And it will say yes.
Mhm.
And so people can see that, but it just doesn't apply to this. So
And when people are calling in for resources, do you ask those questions? I can't remember on your
we
data
don't
that you
ask
pulled.
citizenship. No.
Okay. Okay.
Yeah. And we don't even really ask for residency or anything like that. We are just
Sure.
asking for a zip code or a city or a pinpoint of where can I find local resources to you because I don't want to send you something in like Moffat County if it's not
Sure.
available
Sure.
to you.
Yeah. And probably data that would help
Yeah,
narrow down certain programs if it's like age focused,
exactly.
et
And that's how
cetera.
I was able to find some of our like data points that I pulled today
Yeah.
for people in Aurora zip codes.
Great.
But yeah, okay.
Thank you.
Of
Thank you so
course.
much. This has
Yeah.
really been helpful. I think I'm assuming that like me, everyone else probably didn't realize how much you do.
Yeah. I have my plate full for sure.
Yeah,
Keeps me busy. Well, thank you for having me. Please feel free to reach out.
great. Thank you.
Yeah,
Thank you. Thank you. That was so helpful. And just, I almost feel like we need a refresher on two-on-one like once a year because,
yeah,
as resources change and it's such an easy thing to remember. Like, I don't know, let me just think real quick, where can I send you or where can I tell someone to just be able to go online, um, in real time and take a look
yeah.
is
It's an
just really
amazing
helpful.
program. I'm able to talk about it so extensively because I am passionate about it. People always talk about what is your why? Um, my mom, she was 19 years old when she had me, and she was an immigrant from Vietnam. And I think that honestly, like, had she had known about opportunities like this and there wasn't a stigma around asking for help as an immigrant, I think that maybe I had a great life, but like maybe we could have just had more opportunities. And I think that is what I'm really trying to do is to remove that stigma and to, show people that it's okay to ask for help. And this is a really great way to ask for help is to look for resources like this. Um, and I can really like I obviously I'm very passionate about it because it's a great program with that.
Yeah. Well,
And they
thanks for
treat us
sharing
well
that.
here. Yeah,
Yeah, thanks for sharing your why. We
of
appreciate it.
course.
Um,
Okay. Well,
Thank you. Thank you.
have
We
a
will
great
share.
day. Yeah, if you guys are probably, having your own updates and highlights, so I will hop off. But yeah, Joe, if you could share my information, that'd be wonderful.
Absolutely. Thank you so, so much.
Of course.
All right. Well, thanks all for being here. We hope to see you in the end of May, May 28th, and we'll send updates until then. Thank you so much.